This is Dr. Amir Jamali. The title of this presentation is Rotator Cuff Tears, Anatomy and Imaging. The rotator cuff is composed of four muscles that help stabilize the head of the humerus against the shoulder socket, or glenoid. The four rotator cuff muscles are the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. Here we're looking at a back view of a shoulder model. The scapula or shoulder blade is shown with a bony extension coming off the back called the scapular spine. The supraspinatus is named as a muscle above the spine and attaches onto the edge of the humeral head at a point called the greater tuberosity. The infraspinatus is so named because it's below the spine and attaches toward the back of the greater tuberosity. The role of the infraspinatus is to turn the arm outward as shown by the multiple blue arrows. The teres minor assists the infraspinatus in turning the arm outward. The supraspinatus brings the arm upward in a motion called abduction. Here we're looking at an anterior view of the shoulder joint, looking from the front, and we can see the subscapularis, which is the largest of the rotator cuff muscles. It attaches on a different point on the humerus called the lesser tuberosity. We can also see the biceps tendon, long head, which was discussed in a separate video. The subscapularis rotates the arm inward as shown by the blue arrows. MRI appearance of a normal rotator cuff. In a different video we talked about the different orientations of MRI images. Here we're going to be looking at a coronal image of a right shoulder showing a normal rotator cuff. The supraspinatus muscle is shown by the blue arrows and it appears quite healthy. It travels between the head of the humerus and the acromion bone, which is an extension of the shoulder blade or scapula. Now in an axial view, we can again see the rotator cuff, but here the muscles that are shown best are the infraspinatus and the subscapularis. The infraspinatus is on the back of the humerus and here is shown as a healthy attachment onto the greater tuberosity. The biceps long head, which was discussed in a separate video, is shown, as is the subscapularis attachment onto the lesser tuberosity. MRI appearance of a torn rotator cuff or supraspinatus tear. We're now again looking at a coronal image, but here it's much different than we saw on the normal image. Here the supraspinatus is completely detached from its point of attachment onto the greater tuberosity, and the muscle has retracted toward the midline. There's a void where the tendon should be, and that void is filled with water, and that is shown as a bright spot on the MRI. This has been a review of the findings of a normal MRI of the rotator cuff as well as rotator cuff tears. Thank you.